Corona is an opportunity to look at new ways and to provide new forms of treatment in an emergency and for a large number of patients. Severe courses of this lung infection are characterized by failure of breathing and oxygen saturation in the blood. If left untreated, this condition leads to death. One of the basic treatment alternatives is mechanical ventilation to compensate for this failure of the gas exchange. Symptoms of lung failure are a very rapid breathing, exhaustion of breathing performance, and a drop in the oxygen partial pressure in the blood up to cyanosis. The most traditional and most frequently used and established modes of artificial ventilation is volume-controlled ventilation. This form of ventilation guarantees the application of a defined breathing volume and a defined amount of oxygen. In addition to the volume of air applied, the ventilation frequency is a suitable parameter to meet the individual requirements of the lung tissue. Both parameters are very important and come very close to the pathological conditions of the corona disease. The result of our development is a ventilator that is very stable and can be used immediately in an emergency case. Specifically, this means that the respiratory or air volume can be selected between 5 and 15 liters, the respiratory rate between 5 and 21 breaths per minute. In addition to these parameters, it's a very important from a medical point of view to control the breathing pressure in order to avoid additional damage to the previously damaged lung tissue. We pick up this aspect. As a result, we included the possibility of breath pressure control. In accordance with the previously set alarm limits, a sound signal indicates when this has been exceeded. With regards to the safety aspect, I know from my own 25 years of medical practice the risk of leakage or the deconnection of elements of the respiratory system. For this special but dramatic event, we designed an alarm function that provides the doctor or nursing staff with immediate information if there is a rapid drop in ventilation pressure, which leads to an acute emergency. A few words about the use of the device. As you can see, the control panel is very clear and not disturbed by unnecessary information. In this respect, handling is easy and quick to learn. The ventilator is intended for ventilation with room air that can be enriched with oxygen. This corresponds to the increased oxygen requirements and the restricted oxygen exchange via the capillary network of the lungs. If all the patient's parameters are normalized, the oxygen partial pressure in the blood rises and the disease comes under control. The patient can be weaned from ventilation. We are convinced that this artificial form of ventilation meets the need for quick, safe, and efficient help.